How bad does it hurt to have an ingrown toenail removed? Well, check out this video that I'm demonstrating here, a procedure known as a matrixectomy. And I'll get into actually how we perform this and what a matrixectomy is and how it works. But let's talk about the pain behind this procedure. Many of my patients are feared of coming in to have this procedure performed. They're worried about, are you going to stick the needle under the toenail? Is it going to hurt? Am I going to have to miss work? And it's really a relatively painless type procedure. Most of the fear comes from the actual injection itself. That's the hardest part, and we have to numb the toe in order to remove the ingrown toenail. And we don't put the needle under the toenail. We use a very tiny needle. The needle goes at the base of the toe where we have this green band that you can see. That's just a tourniquet that controls bleeding during the procedure. And we use a cold spray to numb the toe before we give the injection. So it's not actually as bad as you would think. Now, I would say there's a small percentage of my patients that we actually would give them a medication to come in. And I'd say it's such a small percentage that it probably only happens once or twice a year. But we can certainly accommodate patients for that. But I will tell you, most people can come in and we actually do it the same day. It's not that painful of a procedure. You can walk out, drive home the same day. Occasionally, we'll have a patient become lightheaded or faint, and that's common. That's known as a vagal response. And if something like this would happen, and even if it's not during this procedure, if you ever feel lightheaded or you start to get that dark appearance in your eyes or you start to sweat, the first thing you want to do is lay down, and that helps to decrease the likelihood of you fainting, because during that process your body stops the blood flow to your vein. It's that to your brain. It's that fight or flight response, and it gets the blood flow going to other organs, and that's just a normal response. So we can prevent that by getting you to lay down during this procedure, but it's very uncommon to see that. And we're used to making sure our patients are very relaxed. We have a great staff to help minimize those awkward situations or if you're nervous. So what about the recovery period afterwards? Well, even before we get to that, look at what we're doing here. This is the chemical that we use to stop the nail from growing back. And you can see this patient isn't even flinching. They're completely numb. They're completely calm. They're not nervous at this point. They've already realized once the procedure starts that they're numb, they're not going to feel anything. And this just kind of proves that. So then let's talk about what happens when you go home. Are you going to be in a great deal of pain? Are you going to need pain medicine? I don't even prescribe pain medicine for this procedure. Patients can take Tylenol afterwards. Some will take ibuprofen. So what's the difference between Tylenol and ibuprofen? Tylenol is more of a painkiller, and ibuprofen is actually an anti-inflammatory, which indirectly will get rid of the pain. But that's all you'll basically need. And then you're going to soak the gray toe in warm water and Epsom salts twice a day and apply Neosporin in a Band-Aid. So in this particular procedure that you're seeing, this was a chemical matrixectomy, and we use a chemical to ablate the nail matrix, which is the cells that grow the toenail, and that stops it from coming back. So these will tend to take a little bit longer to heal. It can take up to 4 weeks sometime. But when we say 4 weeks, or when a patient asks, how long am I going to be out of commission after I've had this done, it's really only 24 to 48 hours that you want to restrict doing anything. And after those first 24 or 48 hours, we let our patients run. They can pretty much do whatever they want. It is to their discretion. If it's not hurting, they're able to do it. And in regards to work or activities, if you have a desk job, you can probably go back the next day. For those of you that are laborers or you're in work boots, you might want to take the next day off, but certainly you'd be allowed to go back. So what you can see we're doing here now, that's a tourniquet. That tourniquet gets placed on to reduce blood flow. We remove that. That's kind of what we're doing here. It gets pulled away and gets cut. That comes off. The bandage goes on. We use something called Coban that goes over that gauze. And patients will ask, do I have to keep it bandaged like this for a long time, or do I have to keep reapplying gauze? A Band-Aid and Neosporin is all you will need. This gauze bandage comes off after 24 hours, at which point you can start soaking it in warm water and Epsom salt. You probably want to soak it in warm water initially after having the procedure done. That'll kind of loosen up the bandage a little better. Well, if you have any questions about ingrown toenails or how we treat these or anything specific, drop it in the comments section below. I'd love to hear from you.